Hi, my name is Dr. Daniel Roney. The purpose of this video is thyroid solutions. Okay, so if you've been diagnosed with a thyroid problem, the information that I'm going to go over in this video is absolutely critical, and the understanding of that is absolutely critical in order for you to get better. Thyroid diagnosing and treatment, okay, is based on a 50-year-old model. So the current healthcare system that you're in may not be diagnosing you and or treating you properly, especially if you're on thyroid replacement therapy such as Synthroid, levothyroxine, Armour thyroid, what have you, and you're still exhibiting symptoms of low thyroid. What are those symptoms? Fatigue, sluggishness, tiredness, depression maybe, slight depression we see often, constipation. We'll see cold hands and cold feet. We'll see dry, brittle skin, dry, brittle hair, hair that might be falling out easily. Another thing that we see very commonly is weight gain, even on a low-calorie diet. So if you're on the hormone replacement therapy, but you're still exhibiting some of these signs or symptoms, some more than others and some more frequently and intense than others. However, if you are still suffering, there's a very good chance that you don't actually have a primary thyroid problem. Your problem lies elsewhere that's causing the thyroid to become attacked. So this video is going to walk you step by step through what you absolutely need to know in order to get better. Again, without this information, it's going to be very difficult to get better simply because healthcare uses a 50-year-old model of diagnosing and treating the thyroid. And you can surmise that over the last 50 years, we now know a ton of new information regarding the thyroid. Okay, so we'll walk you through step by step a PowerPoint presentation that by the end of this, I really feel that you'll have a great understanding of exactly what you need to know in order to get better. Okay, so we'll get you started and walk you through that in just a second. Okay everybody, so the PowerPoint today, the main purpose here is to just inform you little by little on what you need to understand about the thyroid. Now, overall, a couple quick points that we made in the intro. Number one, medicine or modern healthcare uses a 50-year-old model of diagnosing and treating the thyroid. We talked about that. Number two, most of you, according to science and the latest data that's out there, do not have a primary thyroid problem. You have a secondary problem that's causing the thyroid to malfunction. So essentially, with the training that's out there, the doctors are trained to test typically TSH and T4, two markers. If they're off, they'll give you Synthroid, levothyroxine, Armour thyroid, what have you, in order to try to stimulate the thyroid to make more T4. Okay, now the downside of that is if you actually don't have a primary thyroid problem, which again data tells us, science tells us that most of you do not, you could be burning out the thyroid with that medication or those hormones. And number two, those medications won't actually make you better. And here's why, very simply, because it's not addressing the cause of your problem. Okay, so there's something else going on causing your thyroid to malfunction. That medication is not addressing the cause, and that's the big idea that I want to get over here today. So in short, we're going to use a few slides here to really allow you to understand exactly what you need to know. Without this information, you have honestly very little chance of getting better. Also, what I'll do at the end of this, I'll direct you towards more resources. So I don't want you to take my word for this, okay? I've been going to school for a few years now, just learning endocrinology and the thyroid, among other things, and spent hundreds of hours on just the thyroid. So what I'm telling you is the latest research and data. And this research and data and science is in different references, books, research articles, and I'm going to direct you to those at the end of this. So don't take my word for it. I want you to know that this is coming from the latest science that's out there. Okay? So let me go over briefly my background here and how, as a chiropractor, I'm able to treat the thyroid. Well, I have degrees in my undergrad degree, biology, sports medicine. I'll let you read that. I'm an honors graduate with a degree in chiropractic. I'm currently enrolled in a functional neurology diplomate program. I have extensive postgraduate hours in the fields of functional blood chemistry, functional endocrinology, which is the study of glands like the thyroid, and functional nutrition. Okay, so basically when you see the word function or functional in front of something, or functional medicine for that matter, which is becoming very popular, what it is trying to restore proper function once a diagnosis is made. It's not designed to try to cover up symptoms with medications, although I understand the need for medications in our society. However, especially with the thyroid, those medications may not be what you need, okay? And for most of you watching this video, they're not, okay? So I studied under one of the, if not the leading experts on the thyroid, Dr. Datis Karazian, for the last at least 8 to 10 months. So I've been spending hundreds of hours going through classes with Dr. Karazian, who is the leading expert, and I will direct you to his latest book on the thyroid that can help reestablish or reconfirm a lot of the data that we're going over. So I have over 20 years experience in the fields of human biology, sports medicine, rehab, chiropractic, neurology, endocrinology, nutrition, and blood chemistry. So again, the goal is to find what your problems are, okay, and I'm going to go through these, and then fix them. And that way your body functions better, your health is optimal, and you don't have the signs and symptoms of low thyroid anymore, okay? So the objectives, I want you to understand that if you've been diagnosed with a thyroid condition and if you've been put on hormone replacement therapy, like Synthroid, levothyroxine, etc., but these don't seem to be helping, you may not actually have a thyroid condition, okay? A primary thyroid condition. And again, science tells us that 90+% of you do not. I want you to understand what else could be going on, so we'll really talk about that today. Allow you to understand the treatment and testing used is based on a 50-year-old model. Allow attendees to understand the common testing performed and the absolute necessity for at least 7 more tests, okay? So I want you to understand that your tests for the thyroid that need to be done, most of you have had 2, maybe 3, there's literally 7 more tests above and beyond TSH and T4 that need to be done. Have to be done. Don't need to be done, have to be done. The tough part is that even if your healthcare provider tested all of these markers, when I say your healthcare provider, even what they would call the leading experts in endocrinology or the top doctors, endocrinologists, healthcare providers in the country in Southern California, they're all trained to do the same thing, okay? They're trained to test, roughly, and then prescribe medication. And most of you will not respond well because you do not have a primary thyroid problem. So my point is the information is out there, it's just not being utilized or these doctors are not being trained properly. There's reasons, I won't get into that, but that's just the way it is. So essentially, we need to test a lot more markers, okay? And your healthcare providers, even if you got them to test all those markers, they're still going to do one thing. The treatment out there 99.99% of the time is the same no matter what they find, okay? So I want you to understand how we're different based on the latest science and how we're able to get patients well when others fail, okay? One thing I will say, if you have a thyroid problem, you are very, very unhealthy. The thyroid is responsible for so many processes, functions in the body, that if your thyroid is not working well, you are at a cellular level extremely unhealthy and you are susceptible to many disease processes. And I want to make that point. And these next two slides will help you understand that. So let's look at the symptoms real quick. Fatigue, definitely what I see constantly. Increased weight gain even on a low-calorie diet. Sometimes the morning headaches that wear off as the day progresses. Depression, sluggishness, lack of motivation we see. Constipation is one of the ones that is on every form I see. Overly sensitive to cold weather, poor circulation and numbness in the hands and the feet, muscle cramps while at rest, wounds heal slowly, require excessive amount of sleep to function, chronic digestive problems is also a biggie, and stomach acid. Most of you are on some type of stomach acid medication, and the reality is you have, because thyroid, which you'll see in the next slide, controls your stomach acid, most of you have too little stomach acid. Okay, matter of fact, I would almost bet every single one of you has too little stomach acid, not too much, and I'll talk about that. Itchy, dry skin, dry, brittle hair, hair falls out easily, swelling in the face, loss of the outside portion of the eyebrows, sometimes the eyelashes, etc. Okay, so those are all thyroid symptoms, and if you're still suffering with one, two, or many of these, many of my patients that come in have a multitude of these, and to different varying degrees as well. So if you're still suffering with those, yet you're on thyroid replacement therapy like Synthroid, levothyroxine, what have you, then that's a red flag, big time red flag, that you probably do not have a primary thyroid problem. Okay, so here's one of the most important slides I want you to be aware of. The thyroid support. So if your thyroid is low, you're not getting the following things happening. Your bone metabolism is going to slow down. What does that mean? You're going to be more susceptible to osteoporosis, both males and females. Your immune system is going to be compromised. Your brain and nervous system will be compromised. Your endocrine system, like your adrenal glands, your ovaries, testes, are going to be compromised. Okay? Your gastrointestinal function will be compromised. What do we see mainly with hypothyroid patients or thyroid patients? Your liver or your gastrointestinal function, because you have low stomach acid, okay, which I put down here at the bottom, your foods are not getting digested properly. They try to go from the stomach into the small intestine, and the small intestine says, I'm not accepting that. It's not broken down enough. And it pushes it back into the stomach and up through what they call the cardiac sphincter in the form of heartburn or acid reflux, etc. Because thyroid supports GI function, okay, stomach acid, we see a lot of digestive issues, irritable bowel, things like that, okay, constipation, etc. So your GI function is not going to be well if your thyroid is low, and I guarantee you watching this, it's not. Okay, liver and gallbladder, here's another one. Your liver and gallbladder are controlled by your thyroid for the most part, okay, so when you have low thyroid, what's going to happen is things are going to get backed up into your liver and gallbladder. And for many of you, gallstones and gallbladder is a history. We also see things like fatty liver, etc. So again, having low thyroid, if your liver and gallbladder are not working well, those are your detox systems, okay? They need to be working well, and for many of you, they are not. So when I said on the previous slide that when your thyroid is not working well, you're very, very unhealthy, and you're susceptible to many, many major disease processes, this is why, gang. This is very important. More than just, oh, I have low thyroid. It's very important at a cellular level. Many of you have hormone imbalances, okay? Growth and sex hormones. So thyroid here supports something called estrogen metabolism. Right? This is very important. When your thyroid's low, you're not metabolizing estrogen properly down what they call a healthy pathway. And when that happens, estrogen levels, especially estradiol, a proliferative estrogen to the breast tissue, starts to rise. Okay? Not only that, low thyroid equals low progesterone levels. So thyroid also helps with progesterone production. Now, in order to be healthy and hormonally balanced, your estrogen and progesterone levels need to be pretty balanced. Well, with thyroid patients, we routinely, on a daily basis, see high estrogens, low progesterone, and low testosterone as a result of the thyroid not working well enough to support these. Now, once that happens, the most dangerous implicated disease process as a result of an imbalance there that I just explained is something called breast cancer. Because your higher estrogen levels are proliferative to breast tissue. So that estradiol is the one that causes breast tissue to be the cells to proliferate. Very dangerous, gang. Okay? So those hormone imbalances, a lot of you may be on hormone replacement therapy, and it really is your thyroid that's creating that problem. So you're taking these medications, even if it's natural, you're taking those things, but really the thyroid is the main problem there. So a lot of these problems, we get the thyroid right, and all these things that most of you are taking medications for get better. Okay? So again, we'll see a lot of medications trying to help signs and symptoms that we talked about on the last page, as well as these here. And if that happens, if you're taking large amounts of medication, it's not correcting anything. It's only trying to allow you to function a little better. But again, that's an okay short-term plan, but it's a very bad long-term plan. And it's the lack of understanding that health care providers have as to how to put all these pieces of the puzzle together. All right, fat burning. So basically, fat metabolism is a thyroid supporter. Okay, so if your thyroid is low, you're not burning fat properly and you're gaining weight. Okay, I mean, thyroid also is responsible for metabolism. Okay, so you get those two things going, and you're going to be putting on weight even on a low-calorie diet. Insulin and glucose metabolism. Many of you have dysglycemia. You either have diabetes, insulin resistance, or hypoglycemia. Okay? What that means is you are not getting enough glucose into your cell. In a biochemical pathway, glucose is converted into ATP, which is energy for your cell. So a lot of you that are fatigued are not only fatigued because thyroid is responsible for your metabolism, right? But it's also because you're not regulating your glucose levels properly. So if you have too little glucose in your system, called hypoglycemia, you'll feel irritable, jittery if you miss a meal. If you have insulin resistance, okay, which is too high glucose in your blood, it means that you're not getting that glucose into the cell, and you'll feel fatigued and tired after a meal. Okay, most of you, almost every single one of you watching this, has insulin and glucose metabolism problems. Okay, it can be reversed. Number one, we got to get the thyroid right, but number two, we got to get you on a good nutritional program. Okay, healthy cholesterol levels. Most of you watching this have a triad. You have high triglycerides, high cholesterol, and high blood pressure. Okay, and that has to do with glucose metabolism and thyroid, and then stomach acid we already talked about. So again, I guarantee you're watching this, you saw the last slide with the symptoms of low thyroid, and now I guarantee you many of you are on stomach acid medication. I guarantee you're on cholesterol medication. I guarantee you have either hypoglycemia or insulin resistance. You're gaining weight on a low-calorie diet. Your hormones are imbalanced. Your gallbladder or liver are a problem. You have GI function problems, right? Endocrine system, etc. I guarantee most of you watching this have these problems. We see it every single day. Now again, in order to get these better, there's some things that we need to address first. And getting that thyroid right is a biggie. Okay? So let me move on, because this next slide is also very important. All chronic health conditions have common underlying causes. Okay? So the thyroid in general, when we see a thyroid problem, we know there's certain things over here on the right going on. You have oxygen deficiency to your cells, you have decreased blood flow to your cells, decreased energy for your cell, and we talked about that in the last slide, and increased inflammation, leading to cellular death. And what death are we talking about? The thyroid tissue. Okay? So these four things are going on. Why these four things happen that lead to cell death? Because most of you have those conditions that we talked about over here. Okay? And these need to be fixed. They don't need to be just medicated to try to get your symptoms down so you can function. They need to be fixed. If they're not fixed, you're going to continually, progressively get more and more unhealthy. Okay? So blood sugar imbalances, adrenal imbalances. I can't stress enough how important the adrenals are, and for intent and purposes of this video, we can't go into it heavily. But your adrenals, for most of you, are either hyperfunctioning or hypofunctioning, meaning they're either overproducing some of the cortisols and different hormones, or they're not functioning well enough. So if you've had chronic stress over a long period of time, that initial stress response, you're going to have high cortisol levels. Over time, the adrenals will burn out if the stress is what we call chronic, and that will cause low cortisol levels. Either way, very, very bad. So one of the things we do with all thyroid patients is check their adrenal function. It's called an adrenal stress index. With that, we also test their hormone levels as well. So though these other things up here could also be caused by chronic infections, anemia, autoimmune attacks, immune imbalances. Most of you have digestive problems in the form of leaky gut, and there's some brain imbalances as well that go on. Okay, so again, when we look at this at a cellular level, not only do we have to understand this real well, okay, but we also have to understand why your thyroid is breaking down. And it has to do with some underlying causes that most of you have. Okay? So if we look at those and can understand those and then treat those and get those better, as well as get your thyroid better, gang, your body is going to start functioning better. And then when it starts to function better, you're going to get more oxygen to your cells. You're going to have more blood flow. You're going to have increased energy. You're going to have less inflammation going on. And guess what? Then your thyroid's going to start working better. And I'm going to really talk about that in just a minute, the thyroid specifically. But what I'm doing is giving you what we typically see that goes along with these problems that are never addressed. Okay? I can promise you one thing. The advancedness and the, I guess, specificity, if you will, that we understand is why we get the results that we get. I can almost guarantee you, you will not find a healthcare provider out there that understands to the degree that I'm talking about today as far as the thyroid. It just isn't there. It's not there. The information is out there, but it's not being applied. And if you're still suffering, you know that it's not being applied. Okay? Alright. Very important slide here. Okay? This is something called the hypothalamic, what you see up here, pituitary adrenal axis, okay? The HPT axis, they call it, hypothalamus pituitary. This is, when I talked about in the intro where your other problems could be coming from, this slide is the answer, okay? So let me go through that with you. Up here you see, with my pointer, you see the hypothalamus. That's part of your brain. Then you have your pituitary gland. Now your pituitary gland, just briefly, is responsible, they call it your master gland. It's responsible for growth hormone, your thyroid, your adrenal glands, and your sex hormones, basically, via your testes and ovaries. Okay, now for thyroid function, I'm going to come into the picture here just to kind of show you a little bit. Okay, so here's your thyroid gland, right here. If your thyroid gland is working well, it's producing T4, okay, right here, and T3. Everybody okay so far? Hopefully you're okay with that. So, thyroid gland's working well, it's producing T4, T3. Hypothetically, let's say you fall low on T4, okay? Because, and again, just to let me state this, the thyroid, when it's producing its hormones, 97% of the hormone produced by the thyroid gland is T4. 3% is T3, okay? Hold that thought for a second. So hypothetically, say I become low on T4. I have receptors here in my system that then send information to the hypothalamus that says, hey, we're low on T4. So then the hypothalamus stimulates the pituitary gland. The pituitary gland then stimulates the thyroid via thyroid stimulating hormone to stimulate the thyroid gland to then make more T4. Once T4 is adequate, that process is shut off. Okay? With many of you, this process is not the problem. Okay? In healthcare, that's why they test TSH and T4, because 97% of the hormone produced from the thyroid is T4. Okay? So if you have high TSH, typically you'll have low T4. Again, because the thyroid or the pituitary gland is pumping out TSH to stimulate the thyroid because the brain got information that you're low on T4. That's the general gist of it, okay? But let me take it a step further. Now, if you see right here, T4 and T3, okay? See it right here? The thyroid produces T4. 90% of the hormone that the thyroid produces is T4. Just 3% is T3, okay? In order for us to use these hormones, okay, we have to convert all that T4 into T3. So let me go down here and show you at the cell. T3 is what we use at the cellular level, okay? So, when we have T4 and T3, the T4 and T3 has to be bound to something in order to circulate in the blood. Okay? It is bound on thyroid binding globulin. That thyroid binding globulin is like a taxi cab. Okay, so T4, T3 have to ride around in a taxi cab called thyroid binding globulin. That's the bound form of the hormone. Okay, so it takes a ride. It has to, the thyroid binding globulin has to get T4 into active T3 by dropping it off at the liver, the gut, and other tissues of the body. Okay, so one thing we have to do in our body is convert all this T4 into T3. Okay, 60% happens in the liver, 20% happens in the gut, and 20% happens in the other tissue. Now, what if you have a bad liver, a bad gut, and you're not converting T4 to T3 properly? Okay, that means that you're not going to have enough active T3, what they call free T3, to be used at the cellular level. So part of your problem, ladies and gentlemen, could be conversion of T4 to T3. Okay, part of your problem could be that you have either too many binding globulins in your system, which means all the T4 and T3 is bound, but you don't have enough free form of the T3. You could have too little binding globulin here, and there's reasons for that, and I'll go over that. If you have too little binding globulin, it means that you have too much T4 and T3 floating in the system, and it's going to overwhelm the cell here. Okay? So all I want you to be aware of is that it very rarely is the thyroid. Okay? It very rarely, your problem very rarely lies here, and studies and science proves that. Okay? Your thyroid gland, what they call primary hypothyroidism, is a problem less than 10% of the time in all diagnosed thyroid patients. Okay? So this area is rarely the problem. You may have a problem with your pituitary gland, right, up here. You may have a problem converting T4 to T3. You may have too much binding globulin or too little binding globulin, sorry. You may have a problem converting T4 to T3 in the liver if you have a bad liver function. Gut function is poor. You may not be converting enough in the gut if you have an unhealthy gut. You may have, again, a problem at the cellular level. And I'm going to walk you through step by step those. But for intent and purposes, this slide is irrefutable. This is science. Okay, this is the latest science we know about the thyroid gland. What I really want you to know, in general, after going through all that, is that the problem is rarely your thyroid gland. Okay? The problem lies either here in all these conversions or at the pituitary gland. If you're experiencing way too much stress over time, that pituitary gland becomes worn out. And I'll walk you through these. Okay, gang? So thyroid gland is rarely, if ever, the problem. The problems happen either all the way down here or happen up here, or there's one other thing that I didn't talk about that is the most common, and that's an autoimmune condition called Hashimotos. Okay? So hopefully you understand that. So when we test, okay, thyroid markers, here are the markers that need to be tested. TSH and T4, we see that, right? T3 needs to be tested. Now here's a kicker. These, when we test serum levels of T3 and T4, which is your blood levels, you need to test bound form, the ones that are bound to the globulin, but we also need to test free form. Because the free form, when the taxi cab lets them off, the only way T3 and T4 can be, or T3 really can be used, is if it's free, unbound. The taxi cabs, the binding globulin can't bind it, okay? It has to let it off. And so we need to test the free forms of T3 and T4. We need to test binding globulin. We need to test something called reverse T3. Free thyroxine index. Okay? So all these things have to be tested to find out what your true problem is. And again, most of you had only TSH and T4 tested. Okay? And that's the inadequacy right there of the understanding of the thyroid in modern healthcare. Okay? Hopefully, gang, hopefully that makes some sense to you. If it doesn't, you can call me. I'll walk you through it. But just so you know, the reality is the thyroid's rarely the problem. It's either the pituitary, conversion of T4 to T3, too little or too much binding globulin, etc. And all those things have to be tested. Okay? All right, so I'm going to move on and talk real briefly about Hashimoto's. Hashimoto's thyroiditis is the #1 cause of thyroid conditions in the United States. Some publications estimate upwards of 75% of you have an autoimmune condition. What that means is, called Hashimoto's, what that means is your immune system somehow has turned on and is now attacking your thyroid tissue. All right, let me make this statement. If that's the case, thyroid medication, the hormone replacement therapy, okay, is not going to do much for you, just like the other conditions that I just talked about, because your immune system is the problem. Controlling your immune system so the attack stops on the thyroid is the answer. Okay? It is never, and I mean never, treated that way in modern healthcare. All that's done is medication is given. So if you have Hashimoto's, your labs are fluctuating constantly. They're up, they're down, they're trying to adjust the medication, etc. Also, you will experience over a long period of time with autoimmune conditions, sore, achy joints, muscles that become sore. All of a sudden you have a knee pain, a shoulder pain, a neck pain, these chronic pains that are going on. Again, not all of you may have this, but if you've had Hashimoto's or an autoimmune condition for a long time, this is definitely it. So again, with thyroid testing, especially when it comes to Hashimoto's, okay, there are immune system antibodies that need to be tested. So TPO antibodies, TBG antibodies, and if you have Graves' disease, which is another, not as near as common as Hashimoto's, but it's another autoimmune condition that causes increased thyroid response, you'll see antibodies to TSH. So again, testing, right? TSH, T4 and T3, free T4, free T3, reverse T3, free thyroxine index, and these antibodies all need to be tested in order to find out what your thyroid problem truly is. And like I said, I guarantee you, most of you have not had but maybe 2, 3 of those tests done. And that's a shame, okay? And that's why you're still suffering right there, okay? So, immune system, for intent and purpose of this video, I just want to go through this real quick. Your immune system, if you have Hashimoto's, which a lot of you do, whether you've been diagnosed with it or not, is a result of something called dysregulation of your immune system. Your immune system is imbalanced because of stressors to it. And it turned on, this autoimmune condition turned on because of something that went awry somewhere down the line. You know, we'll see a lot of patients that come in that had a viral infection, a bad viral infection, and all of a sudden their thyroid started to misfire because now their autoimmune system has been kicked into high gear. We'll see chronic stress do this, traumatic events, etc. Either way, when your immune system is dysregulated, it basically means your cells are attacking not only unhealthy tissue or foreign invaders, it's also attacking healthy tissue. And in this case, it's attacking your thyroid. Okay? Other things, in order to get the immune system under control, we also have to understand if you have any active invaders. So immune system is imbalanced due to an invader, aka an antigen. So an antigen, when I say antigen, it's an invader. What else could you have going on? Chronic infection, bacterial, viral, mold, parasitic infections in the gut. Some of you, as far as when you're eating certain foods, those certain foods are going to increase your immune response, and they're very detrimental. So I hear a lot of Hashimoto's patients that may feel good one day and then go stretches of feeling bad. May feel good, may feel bad, and it's an up and down battle as well as their labs. It all depends on how bad the attack is that day. So one thing that we need to do when we look at the immune system is find out what's going on with the dysregulation, and that can be tested, as well as making sure you don't have any active antigens going on. If we can do that, when we test those thyroid antibodies, what we want to see over time are those antibodies getting less and less and less. What that tells us is that there's no longer an immune response against your thyroid. And that's exactly how to get that thyroid working better, to stop the immune response. But again, It's never done that way. It's never looked at that way, and science clearly tells us that it has to be. Okay, I can't stress that enough. It's just it's a shame is what it is. Okay, so treatment for Hashimoto's, proper testing. Okay, we have to find out what's going on with the immune system. Okay, are those antibodies present? And then we need to remove the invaders, the foreign invaders, and the cause of the dysregulation to modulate the immune system. Again, if we can do that, the attack on the thyroid tissue is no longer going on. It's not cured, mind you, but it's no longer going on. And if you keep it that way, then your thyroid gland conceivably should start working much better. Okay? Now, I'll just say this real quick. If you've had Hashimoto's for a long time, meaning your immune system has been attacking those tissues for a long time, there is a possibility that a lot of thyroid tissue has been damaged, and you will no longer on your own without that medication make enough. However, not getting the immune system properly regulated so it's no longer attacking the thyroid is an absolute necessity. Okay, because the thyroid will just keep getting worse and worse, and you need more and more medication, number one. And number two is that an autoimmune condition does not only attack, especially Hashimoto's, the thyroid, it'll start attacking your brain tissue, it'll start attacking your pancreas that makes insulin for blood glucose regulation, and it'll start attacking your myelin sheath that is responsible for peripheral neuropathy. Okay, so we see a lot of autoimmune conditions that have neuropathy. So again, we need to implement some things that are going to help stop the immune attack. If that's not done, gang, I'm telling you, you're in for a world of poor function in your body, a lot of pain, and a lot of unhealthy traits, if you will, and disease processes. So very, very important there. All right, so when we looked at the slide, excuse me, when we looked at the slide with what I call the hypothalamic pituitary axis, where the thyroid, we looked at the conversion. The 6 major patterns that we see are right here. Primary hypothyroidism, hypothyroidism secondary to hypopituitary function, we talked about that one. Thyroid underconversion, thyroid overconversion because you have too little TBG. This one you may have too much TBG. TBG elevation, and I'll explain why these things happen. Thyroid resistance, etc. So here are the 6 most common patterns of thyroid dysfunction. Okay, there are, according to top experts, upwards of 24 different patterns, but I go over the most common 6. Okay, now let me talk about this. Primary hypothyroidism, the first pattern that we commonly see, is actually a thyroid problem. This is the only one that may need hormone replacement therapy and that the patient will respond very, very well to. Okay? So primary hypothyroidism is tested, okay, by looking at a marker. TSH will be high, but your T4 will be normal, okay? And we can pick this up. Any of these patterns can be picked up if we just test properly, okay? So primary hypothyroidism constitutes maybe less than 10% of all thyroid diagnosed patients, and if you have primary hypothyroidism, the hormone replacement therapy has done you really, really well. If you have a thyroid problem, are on the hormone replacement therapy like Synthroid, levothyroxine, etc., but you still have the signs and symptoms and problems that we've been talking about this whole tape or video, then you do not have this primary hypothyroidism. You have either Hashimoto's or you have one of these other 4 or 5 patterns. You may have hypothyroidism secondary to pituitary hypofunction. Why might you have that? Chronic stress fatigues the gland, okay, and the pituitary can no longer pump out the right amount of TSH. Hormone pills including Synthroid. So Synthroid can actually be burning out your pituitary. Creams with estrogen. Postpartum depression, pregnancy can fatigue the pituitary gland. And big one, fluctuating insulin glucose levels, which is secondary to adrenal gland fatigue. So again, with proper testing, we can diagnose that, accurately diagnose that very quickly. All right, thyroid, another pattern is thyroid underconversion. The gland is making enough T4, but there is a decrease in conversion. Remember I talked about you're not converting the 97% of T4 into the active form of T3. Why? Chronic adrenal stress gives rise to increased cortisol, which suppresses T4 to T3 conversion. Chronic infection or inflammation may also be occurring that's causing this, okay? It's often missed because low T3 doesn't affect TSH, only T4 does, and T3 is rarely checked for with the blood test, okay? So again, intake form, we see chronic stress going on, we do an adrenal stress index, and we see that the cortisol levels have been high over time, and then we understand, looking at those tests, that we can say, you know what, this is a conversion problem, okay? It's not a thyroid problem. So if you get this problem right, the thyroid gets better, okay? And that's with all of these. Again, they're not thyroid problems. You have problems with conversion. You have problems with because of stress or chronic infection or inflammation, what have you. Thyroid overconversion. If you're overconverting T4 to T3, okay, or you have decreased thyroid binding globulin, it means you're going to have too much T3 in the body, and it's overwhelming the cells, right? If you have too much T3 constantly, you're at the cellular level where T3 works, that does all those functions that we talked about, the cell it works on becomes tired because it's always there, okay? The number one cause of this is insulin resistance, especially in women. That's where your blood glucose levels are borderline high on your labs and you get fatigued after a meal, okay? Usually you're also a little bit, possibly a little bit overweight as well, and that's because you're not getting enough fat metabolism and you're storing a lot of glucose, okay? And that's going to cause the overconversion. The cells are not listening to insulin, so more insulin is secreted. This also increases testosterone levels in females, resulting in too much free form of T3 and too little binding globulin. Remember, the binding globulin is the taxicabs. So if you have too little taxicabs, you're not getting enough T4 and T3 to circulate through the body, okay? So thyroid overconversion is another pattern that we see that, again, the right testing can diagnose this very, very easily. Thyroid binding globulin due to TBG elevation. So you have too many taxicabs, so all the T4 and T3 is never dropped off to be a free form, and thus you have too little T3. Oral contraceptives or estrogen replacement therapy causes an increase in estrogen, which leads to an increase in binding globulin. Okay? So again, if I see on an intake form that somebody's on these oral contraceptives or estrogen replacement therapy, I almost know right away that their thyroid problem is secondary to binding globulin problem. Okay? Very common. This one's very common. Okay. Thyroid resistance is basically the pituitary and the thyroid glands are fine, so are the hormone levels. However, the hormones aren't getting into the cell. This is one of the more rare ones of the 6 most common that we see, but chronic stress stimulates the adrenal gland to produce too much cortisol, which causes the cells to become resistant to thyroid hormone. So stress, if you've seen one thing, chronic stress is a big detriment to the thyroid. Okay? So, bottom line though, bottom line is this. If you're taking the hormone replacement therapy, but you still have these signs or symptoms that we talked about in the beginning of this video, okay, you have either Hashimotos, okay, or one of the other 5 patterns here. Most of you do not have what I talked about as primary hypothyroidism, okay? Most of you have one of these patterns. The intake forms almost lead us into the intake forms that I have you send home and fill out, or I send home to you and fill out, lead us in a direction. And then all we need to do is test some blood or do some testing, and we can find out very quickly where your problem lies. Okay, and unfortunately that just hasn't been done for you. Okay, so we talked about the adrenals. Again, stress induced. It can be from sympathetic overload called fight or flight. So if you get scared, you know, you're in a dark alley, somebody comes up behind you, that's fight or flight. But when we're stressed, whether it's from emotional stress or physical stress or chemical stress, this sympathetic overload is going on. Plus, you could have infections in your body and or autoimmune conditions that will tax those adrenal glands. Again, high stress equals high cortisol, and that's very bad. If you have high stress over a long period of time, those cortisol levels, the adrenals will fatigue and you'll have low cortisol levels, okay? So every patient that comes in our door, we do salivary testing to determine cortisol levels in the morning, noon, 4, and 8 p.m. as well as DHEA and all your sex hormones, all your estrogens, progesterones, testosterones, melatonins, etc. Because we need to find out where your major problems are coming from. Okay? So the testing that is done, most of you have had complete metabolic profiles as well as complete blood counts. Okay? But if not, we will test those. Okay? We need to find out your liver function, your glucose levels. We're going to do a complete thyroid profile, including those 7 markers plus, maybe 7 to 8 markers there, plus the antibodies. Vitamin D, most of you are low on vitamin D. We need to find out if you're anemic, if you're not carrying enough oxygen to your tissues. We need to find your kidney function. If you have an autoimmune condition, we may check immune panels. With every single one of you, we check adrenal stress index to find out your cortisol levels as well as your hormone levels. Okay? Very, very critical. And then some of you, we may do food sensitivity testing, or we could do stool testing to find out if you have digestive infections, etc. Basically, we need to find out the underlying cause of your thyroid malfunction. That's really what we need to do with these tests. Okay? Do we also see anemias, dysglycemias, leaky gut, adrenal fatigue, hormone imbalance, thyroid meds, immune system dysregulation? Yes, brain neurotransmitters. We see those problems almost every single day with almost every single thyroid patient. Okay? So, again, bottom line is, you've been grossly misundertreated. That I can tell you. Okay? And this, hopefully, if you got anything out of this video, it tells you that the science that's out there is not being applied. Okay? So a quick recap. We know that healthcare uses a 50-year-old model. We know that the number of tests that need to be actually done for your thyroid, and we know why now. Hopefully you get an idea that there are so many other things that need to be tested and recognized to find out what your true cause of your thyroid problem is. And again, most of you don't have a primary thyroid problem. So if you still have symptoms, there's almost 100% certainty you have either Hashimotos or one of the other patterns that we talked about. It's not a direct thyroid issue. If you get those other things right, the thyroid should kick into gear, okay? It's important to realize that even if you convince your doctor to do these tests, they would still, no matter what the labs say, treat with hormone replacement therapy. And that's not what most of you need, okay? And again, you just need to understand that that's the way they're trained. They're trained to do a couple tests and put on medication or hormone replacement therapy. Again, not their fault, it's just the way their training is. Again, 50 years, we've learned a lot on the thyroid, okay? So, if you're using a 50-year-old model, it's woefully inadequate, according to the latest science. We're different because we understand that these are not directly thyroid problems. We understand the testing needed to be done, and we understand how to effectively treat and fix the problem. These treatments are based on scientifically proven, research-tested methods designed to fix the problem. Okay? That's your recap. Next step, depending on when somebody comes into our office, let me just go to the next one. When somebody comes into our office, we have them fill out a lot of paperwork that guides us. Okay? It's very, very thorough because we need to ask specific questions, and with your history, okay, coming into the office with all those forms filled out, we do a history, we do a complete exam from head to toe, whether it's reviewing your labs and finding out what labs may need to be done. We do a full musculoskeletal, a full neurological exam, okay, and evaluate you from head to toe. The only way to get somebody better, to improve their function, improve their health, and improve their quality of life, is to look at your body as a whole, not individual parts. Okay? So when we do that, we can find a lot of answers. And again, let me just say this. Your file, when you bring in your file, it probably looks very similar to the other thyroid patients that we have under care and the ones that I've treated over my course of being a healthcare provider. You have very common findings, okay, that are very common to everybody else, okay? So sometimes there's curveballs, but rarely. All right, so when I accept somebody in for, we do 2 free visits, by the way, and I'll talk about this in a second. So you can come in to see me for 2 free visits, but there are rules for acceptance. You must be willing to make some lifestyle changes. You must be committed 10 out of 10, no less. What I mean by that is you have to say to me, Dr. Roney, I'm tired of feeling this way, I want to get better. Okay? And if it makes sense, I will do what you ask me to do. You have to take accountability for your health, all right? Insurance questions, we're not sure if there's coverage until we verify, but count on some out-of-pocket expense. And let me just say this. We have programs available in our office that allow this care to be affordable to almost every person that walks in the door. I have somebody right now that makes $12.30 an hour that is able to afford our care because her commitment is a 10 out of 10 and she's tired of feeling the way she's feeling. That is up to you. It is not up to me. I cannot make you a 10 out of 10 if you're not, okay? But commitment equals better health. Must have new patient paperwork back 48 hours prior to first appointment. No exceptions to that one. I need time to review it. I spend literally hours on every file before I sit down with the patient. I skipped one. The spouse or significant other must be with you with your appointments. That is non-negotiable. And the reason I do that is because we're going to go over a lot of information. And in order for the spouse to truly understand, or significant other to truly understand our programs and what we're going to be doing, they need to be sitting in listening to this stuff. There's no way you can articulate to your spouse or significant other all the things that you're going to learn with me one-on-one. All right? And then I'll send you home with Dr. Karazian's book, which I'll go over in just a minute. And I have every patient, before they come in, read the first 3 chapters of that book. And then understand, in that book there's over 600 references, and I have an additional 1,200 references. So that's 2,000 references to support everything I told you here. Again, everything on this video is irrefutable black and white science. Okay? The final step, I call it the life preserver. If you want to get better, this is the life preserver. Patients that want to get better, all they have to do is swim to it, and we've got it. Okay? But that's up to you whether or not you want to get better or not. I can't decide that for you. All I can tell you is the science that's out there, that with a thyroid problem, you're extremely unhealthy and it's only going to go one way, okay? And there's not many people out there that are going to be able to help you with this, I promise. It's unfortunate, but it's just the way it is. So we offer 2 free trial visits, okay? And typically it's a $450 process, but for a short time, at least for the next quarter or so, I'm going to do it for free. On my website, www.orangecountythyroid.com, I go over why I do that. There's reasons why now I'm offering a couple free visits. Essentially, I know a lot of patients, this is new information, they're a bit skeptical. I get that. My objective is to try to give as much resources and references to you so that you can see this is very clear black and white science. And then you could come in and we can talk and go through to find out if you're actually a candidate for our care. Okay, some of you may not be, so we need to find that out, and I give you those 2 free trial visits in order to determine that. But you definitely have to do some things that I ask you in order to even get those 2 free visits, okay? So www.orangecountythyroid.com, www.askdrdanielroney.com is also another website, and a third one is www.thyroidbook.com. So the book is by Dr. Datis Karazian, and it's called Why Do I Still Have Thyroid Symptoms When All My Labs Are Normal? Okay, so I highly recommend that you go buy that, but if not, we're going to have you read it because we have about 10 copies that I give to every new thyroid patient to loan out, okay? But that thyroidbook.com will give you some of the references, some of the resources, some of the research that's out there. Again, all black and white science, gang, okay? So your first 2 visits, complete neurological evaluation, review of existing labs, bring everything you have in, review of all the paperwork, okay, and a complete head-to-toe evaluation. Must be with spouse or significant other if applicable. Case review on visit 2, we review everything, okay? I'm going to go over your symptoms, your signs, I'll piece everything together for you as far as why you're having the problems you're having, what we need to start with first, what we need to then tackle in a program step by step in order to get your thyroid working better, in order to get your health, right, quality of life and function restored today and basically the rest of your life, okay? So what you're doing is starting to invest in your health for the rest of your life. Because if we get these things fixed, you're not going to suffer like I've seen hundreds of patients suffer when they have thyroid problems that aren't fixed, okay? So we'll overview our treatment plan, review of financial obligations, and again, you must be with your spouse or significant other, okay? So that, in and of itself, is the overview here. I know it was a little lengthy, gang, and I apologize for that, but some of this information you have to have, or else you just won't get better. Okay? So I wish you the best. Call Terry if you haven't already been scheduled for those 2 free visits. Come in, sit down with me, and I'll walk you through some things step by step. I have a lot of handouts and whatnot, and I try to piece by piece give you information that'll help you get better. And the one thing I will promise you is that I will give you everything I've got in order to help you. I know that there's not many people out there that understand it to this extent. I know you're suffering, okay? And I know most of you want to get better. You just need, like the life preserver, you need to know how. And that's my job, is to analyze everything in its entirety and tell you exactly how we're going to get better, okay? So utilize the resources and get yourself informed. And when you do that, you'll have a much better chance of getting healthier, okay? So call us if you haven't already scheduled those 2 free visits. Terry will get you scheduled, and I really, really, truly wish you the best, and I look forward to seeing you and helping each and every one of you, okay?